I would want to take this opportunity to welcome all of us to celebrate. I think 30 years is a long time that is worth celebrating.
Linkoping as a strategic partner in Africa, and it is Moi University.
The relationship has been extremely beneficial to us, and I hope it has been the same for our colleagues in Linköping University.
Congratulations to MTRH, congratulations to Moi University and the county government of Uasin for the 30 years of collaboration.
Moi University was established in 1984 as the second public university in Kenya. There are over 1,000 academic staff and over 2,000 supportive staff employed by the university. The university has 15 schools with a population of over 35,000 students at undergraduate and postgraduate level.
Moi University has 8 campuses, ranging all the way from the coast, Nairobi, largely in Eldoret town, and Kitale, and in Western Kenya, Odero Kano. Our strength is in various schools, but largely School of Medicine is one of our flagship schools where we train medical personnel or medical students who are going to serve in various fields, from public health, in medicine, in surgery, in nursing.
The training of health professionals in high institutions is dynamic and ever-changing. In Kenya and Sweden, the changes and challenges at both policy and practice levels to gain competencies, skills, and attitude. This demands equally proactive and innovative health training institutions able to cope with the new developments.
The School of Medicine was established about 30 years ago in 1989. And the founding dean was Professor Harun Mengech. Our first students were admitted in 1990 to join the MBCHP program. At that time, it was called the Faculty of Health Sciences rather than the School of Medicine as it is called now. And the founding dean established the school together with the original team that set up the school on a philosophy of collaboration in the realization that it is not possible to train a world-class health worker without giving them a global context, even as you give them training in the local realities. And so, right from the outset, we started out working together with international partners. Among the first international partners that we worked with were, institutions from North America like Indiana University and the consortium there, institutions in Europe including Maastricht University, and very importantly, our relationship with Linkoping University.
The collaboration between Moi University and Linkoping University began through Kenya's Ministry of Health desire to begin a program at Moi University, the country's second public university.
Faculty of Health Sciences, which is now the School of Medicine, had already signed an agreement with Linköping University in 1989, funded through the Ministry of Health as a component of the primary health care. So by 1995, in December, I got a formal appointment as the coordinator for Linkoping Moi University collaboration, which was loosely called SIDA, because SIDA was the Swedish International Development Agency funding the Ministry of Health in Kenya. And there were several components at the Ministry of Health. So Moi University became a component under the primary health care.
The pedagogy was to be the very latest, so they turned to Linkoping University, which had received attention worldwide with its new pedagogical model, problem-based learning.
Linkoping is also a relatively new medical school in the grander scheme of things, of course. And they were using the same model of training that the School of Medicine at that time decided to use. This is the problem-based learning and with a heavy component of community-oriented teaching and early research exposure. So with these similarities between our programs, we were both members of a network of medical schools that utilize a problem-based training, but also have a community-oriented program. So this relationship has been going on, and we are celebrating 30 years of that relationship this year.
In 1989, a Kenyan delegation went to Sweden. An agreement was signed and it gave way to Linkoping University, supporting Moi University set up the medicine program, and this has evolved to the building of special ties among the two institutions.
We share a lot in regards to the training methodology, using interprofessional education, where we have nursing students, medical students, physical therapy students working together to solve problems that afflict our population. And the other similarity, as I pointed out, is problem-based learning, and we have worked closely with our partners in Linkoping in refining the methods of delivery as far as problem-based learning is concerned. And we are in the process even now of revising our curriculum, and we are taking in lessons learned over the past 30 years to develop curricula that are innovative and unfailingly innovative and different from curricula for the same programs in other institutions.
With the medicine program up and running, the two universities developed an exchange program.
In the initial years, we took many members of staff to Linkoping. I think well over 90 members of staff from the school to see how the problem-based learning was implemented and also benchmarked. There was also the staff exchange from Sweden. The initial stages, we got a number of resource persons who came, ran courses with us, workshops.
It started small, and we had initially an exchange of faculty from Linkoping who came to Eldoret and worked with us in the initial phases of the curriculum development. Later on, we developed much closer relationship in terms of exchange of staff, not just for curriculum development, but also for teaching and clinical care in Eldoret and the surrounding counties. The relationship has matured over time. It has involved the exchange of students, and right now we have very senior professors just about to retire who are spending a substantial part of their time in Eldoret and working with the academic staff at the School of Medicine.
Over the years, students and teachers have spent time at the other university to expand their professional perspectives. Approximately 385 students and 250 faculty.
I was among the very first ones to be taken in for the exchange program, so I had an experience in Linkoping. That was in 1995. And since then, I think we've continued to have a collaboration, which has become very useful, very fruitful. Our undergraduate students go for the exchange program. The postgraduate students have not had any linkage between the university and Linkoping. Presumably that will come in due course. But the undergraduates get the opportunity to have an experience in Linkoping. Their students have an experience as they come here. And it is 30 years of great collaboration that has become very useful and helpful, not just at an individual level, but at an institutional level.
Being the fourth cohort of the AVH program, a lot of what we were learning, especially looking at, was very theoretical, in terms of some of the courses, solid waste management, water management, you'd learn what is the ideal, and it was nice to go to Linkoping and see what some of those ideals were, and how we could better services in Kenya, and where our gaps are as a nation, and So we were able to put into context what we were learning in class, and we were able to share back with our colleagues when we came back in terms of what are some of the things that we should do as public health officers in a better way. And I believe even in my current job, I still look at what were the ideals and why should we serve ourselves less as a nation. You know, we should always make sure that we are giving ourselves the best, and we learned a lot from them and still put it into practice to date.
So since 1997 up to now, we have graduated well over 1,400 medical doctors. We have also graduated more than 400 public Bachelor of Science in Environmental Health, which is public health, and also close to 500 in Bachelor of Science in Nursing. Those were the main programs that the funding initially funded in the 90s. And towards the end of 2000s, there were new programs which Moi University began to look at. And I think in 2010, 2011, the Bachelor of Physical Therapy, which was the first one in the university, was now funded.
Over 30 years, we started out as a new medical school, new medical program. Today, we are the leading medical program in this region. And we have other institutions in Kenya and in the East African region coming to our medical school to see what we do differently and the kind of training that we do in order to produce the graduates that we have. We have also a component of electives in all our programs, and during electives we have student exchange. So our students go to Linkoping, where they spend up to 2 months in some cases, appreciating the different health environment that our colleagues in Linkoping operate in. And at the same time, we also receive students from Linkoping who come here on student exchange, and they also get to appreciate our unique context.
We are 2 medical students from Sweden, from Linköping University. We spent 8 weeks so far in Kenya, and we really enjoyed our time so far.
Yeah, we have. We've been staying in a nice house close to the hospital, so we walk here every morning. We've been 4 weeks in surgery and 4 weeks in casualty right now. And our last 4 weeks we will be in IMED.
Yeah, so starting with surgery, we had 4 great weeks, learned a lot. We attended surgeries, theater, clinics,
ward rounds.
We did that.
Some minor procedures. Yeah. There's a lot of students, so we've been tagging along Kenyan students, and they have been really helpful.
There is also collaboration at research level.
We have been working together to identify common areas of research so that we can generate new knowledge that will then guide practice, but also guide the training that we do in this area. We have had a strong collaboration in clinical care, where our partners from Linkoping have been able to come here and, working together with our clinical teams at the Moi Teaching and Referral Hospital, have been able to establish standard of care, especially in child health, neonatology, maternal health, and in the area of patient safety, where we have had a lot of collaboration, and it has improved the quality of care for our patients at our teaching hospitals, both at MTRH and at the other facilities that we use for training.
Moi Teaching and Referral Hospital also came on board naturally as a twin institution to Moi University, and our areas of collaboration have been mainly threefold. One, and the earliest, has been in orthopedic surgery with Dr. Krista, who is now called Kiprop, has been working with us for the last almost 25 years or 30 years in that department. A lot of surgeries have been done, specialized surgeries. A number of Moi Teaching and Referral Hospital doctors have been trained to become orthopedic surgeons. A number of other surgeons from the rest of the country and the rest of Africa have been trained through that program, where MTRH is working with Moi University and University of Linkoping through Dr. Krista. So our flagship remains orthopedic surgery, and it remains the oldest. Also in that department, we have received a donation of almost 100 beds, fairly new and reconditioned beds, which are very good and very comfortable for the patients. And the beds have been used beyond orthopedics department, beyond the wards of orthopedics. We are using them also in the medical wards. We are using them in the private wards of the hospital. So you can see that the impact through orthopedics alone is great, and we really thank University of Linkoping for this cooperation. Then in the newborn unit and maternity, we have also had a long-running collaboration lasting over 10 years, whereby a total of 11 MTRH doctors, medical officers and specialists, have gone to University of Linkoping and to Sweden for further training in various aspects to do with neonatal care and maternity care. A total of 15 nurses also have gone for further training for neonatal care and midwifery nursing, all courtesy of this great collaboration. So we have had exchange programs where staff and students from Sweden have been coming to our labor ward, to our maternity and to our nursery. And also we have had this number of Kenyan doctors, MTRH doctors and nurses going to University of Linkoping for a similar engagement, normally lasting up to 6 weeks at a go. And I've seen a lot of good results in terms of the way they take care of patients whenever they've gone for that training.
I've been to Sweden twice, 2016 and 2018. My experience has been that over the years since we started the collaboration in 2013, there's been great changes in terms of clinical care in our directorate. In our directorate, I mean maternity, not maternal care, and also neonatal care.
I've had the privilege to visit them at Sweden, and we have learned a lot from them. The way all of them work as a team, without recognizing who is the doctor, who is the nurse, who is the nurse assistant, but always work as a team to give the care to the patients. I have learned when they came to Kenya and to our unit, newborn unit, we have learned how to work together with the mothers to lessen the workload as we give the care to the babies. They showed us how to incorporate the mothers, even to take vital signs, how to do some procedures, which we, the nurses, we were doing, and it was giving us a lot of work, and we were not able to work. We were complaining of burnouts, workloads, but when this team came, they gave us an idea of inventing charts for the parents. And the parents were able to we taught them how to take temperatures, how to decontaminate the thermometers and take temperatures and record in the parents' record chart, so that when the nurse comes, can come and copy or repeat which was abnormal. They also gave us an idea of writing all the normal ranges on the wall, so that when the mother takes the temperature, can look at the chart at the wall and get to know what is abnormal and report immediately to the nurse in the room. We have also learned how to share tasks with the parents and how to spread the task for all of us in the cube. Like we were doing all the procedures in the morning shift, but they taught us how to take top tailing the babies. We can take to do it in the afternoon, so that the morning shift, it is not overloaded with a lot of work. They have also taught us that we can do weighing of the babies in the morning by the night shift team. They do weighing of the babies in the morning, so that those who are working from the morning shift, they don't start with a lot of tasks. That made us to leave only medication and the care of the babies and ward rounds to the morning shift only, of which the shift was too loaded. Nobody wanted to come for the morning shift because of the many activities which were involved in the morning shift. They also taught us on how to afford defensive medicine. They have taught our registrars, our residents on how to have evidence on giving drugs to the babies. And this also has meant us as nurses to have less work because they are able to discharge babies on time. Those who don't need medication for a long time, then we have only those who need medication in the hospital. This also has prompted the hospital to purchase the machines, the CPR machine, to give us a good idea on which baby requires an antibiotic and which baby requires to go home on oral medication. And that idea came with the Swedish team, and we are very grateful, and it has made our work to be easy. They have also told us with so many preterms we have in our unit, they have told us on how to give push feeding. We used to give NGT feeding by holding the tubes for the feeds to flow for a long time, but now after we have interacted and we have gone to their place and we have seen that push feeding works, while for us we are fearing that it can choke the baby. Now we are pushing feeds and we are taking the shortest moment possible to start feeding babies who are not able to feed, who are supposed to feed through the MGT. They have also told us other ways of improvising caps to ensure that babies don't get hypothermia. They have even shown us how to modify the materials we have. They showed us with a crepe bandage on how to make caps, even for the CPAP, and we are able now to do that without saying that we don't have caps in the hospital. This is their idea and it has helped us, and we are now doing it as a routine. It has now become part of us. We have also learned from them the golden minute, which we knew, but we have practiced many times with them each time they come to Kenya, and it has now become part of us on how to fight for the golden minute once from labor to NBU, and how to maintain the warm chain for the preterm. They have taught us on how to put the babies in a polythene, even to an extent of sharing what they have with us to know that it works, so that as we do our procurement, we can now procure those polythene to put our babies inside who are born preterm and maintain the warm chain, and so that our babies may not die of hypothermia. I would also say that they have helped us to know how to interact with our caretakers. They initially used to think that the mother had little role to play in the care of the baby. But as we kept interacting with them, they have told us the mother is very key to the care of the baby. And whatever we are doing to the baby, the mother must know. This has meant even all of us, whatever we are doing, we discuss with the mother on what we are doing so that they are conversant with the care of the baby. And even after discharge, they will be able to continue with the care of the baby. This has also led us to have the idea of starting a kangaroo care, of which at Sweden they don't have the kangaroo mother care, of which fathers can as well do. But through that interaction with them, we learned we can even go ahead and start having mothers doing the kangaroo care, which we have already started. And it was a good lesson for them that we can implement that using a simple room. And now the babies are being discharged at a very high rate, those who are born preterm, and they are shortening the length of stay in the hospital. And I was happy to hear from them that they would like to go back to Sweden and see how they can start a kangaroo care, of which we told them the mother must be cancelled and accept to stay on the bed or to walk around with the baby in between the breasts, so that the hearts of the mother and the baby are communicating.
That has helped greatly in reducing this pressure for nursery and for the machines that we have in nursery. For example, the incubators and the cots and etc. This also reduces a lot in terms of staff needs, because when you have each mother taking care of their baby 24/7, feeding them and warming them, you reduce the number of nurses significantly. The other thing that we've had in terms of our experience with the Swedish collaboration is the aspects of simulation. We've had a lot of training on simulation in terms of how to take care of emergencies, how to take care of various aspects to ensure that mothers and babies survive. We also have had various trainings, a lot of them in neonatal resuscitation, and in this aspect I think it has helped us significantly to reduce on neonatal mortality.
Another area that we have been cooperating is in occupational therapy, in physiotherapy, basically those two, particularly in matters of movement science, and by extension, even the training, the Bachelor of Science in Physiotherapy has come as a result of cooperation between MTRH, Moi University, and University of Linkoping. And then there is a cross-cutting, a fourth area, a cross-cutting program that really is very useful to MTRH is patient safety. Again, led by Dr. Krista and other colleagues from University of Linkoping, and locally led by Dr. Makaya Denge, a chief medical specialist, ENT surgeon in MTRH, with Sister Mungai, who is the deputy director of nursing services. They have had this patient safety program for the last 5 years now.
So in patient safety, we look at the patient care provision, look at any adverse event that the patient may have gotten in the process of care. And an adverse event is harm or injury that a patient can receive while receiving care. The injury may be injury causing temporary disability or even permanent disability, or even some patients may die due to healthcare related harm. Even globally, the World Health Organization has said that 14 patients out of 100 may get hospital-acquired infections. At the same time, there's a lot of money that can be wasted in giving poor quality healthcare to patients. In this collaboration with the Linköping University, we have learned how to undertake root cause analysis. In root cause analysis, you look at the care provided, identify any gap that may have contributed to a patient being harmed, look at the root causes, what caused it, address the system so that in future you can have better care to the patient. A series of root cause analyses have been done at MTRH, and we have found that most of the causes are actually system related, such that it is not the healthcare providers who do the harm intentionally, but it is as a result of the system they are working in that the patients can get harmed. So when that one is identified as a root cause, then it is addressed to ensure we have good health working environment so that we can provide good care to our patients.
This root cause analysis, this patient safety, has been taken to another level beyond MTRH. We have now gone through the Ministry of Health by working with the Office of the Director of Nursing Services at the Ministry of Health. We are rolling it out across the whole country. And as MTRH alone, we have already sensitized the 21 counties who refer patients to our region on patient safety, so that we can be sure that the patients who are being referred to us are safe while being treated in those hospitals, and also when they are being referred to MTRH. So that we have similar systems in the lower level and in the higher level of care. So much so that we have reached a point now that as a board, we are appointing a nurse manager in charge of patient safety. The only one in the Republic of Kenya, and I know many other hospitals in the private and public sector will benchmark with us and also create similar positions, pass similar policies, and therefore utilize the same system of patient safety and root cause analysis to improve and reduce on the many cases of medical errors that we normally hear about in various health facilities across Kenya and across the East African region.
Patient safety is very key, and it is actually safety to the patients themselves, to the healthcare providers, and even the community at large, such that we have to look at the safety of the healthcare workers, the safety of our patients, and even the safety of the community. What is coming out clearly is that in the event there is an adverse event, even the healthcare providers are really affected, meaning that we have to acknowledge what has happened and really support them so that they are able to learn any adverse event
being encountered at Moi Teaching and Referral Hospital is used as a learning point.
Through the collaboration with Sweden, we've introduced the labor coordinators. Labor coordination has really helped in terms of having somebody who is more knowledgeable than the rest of the nurses, so that they're able to coordinate between the nurses, the doctor, and the patient, and also the theatre and also management. So in terms of labor coordination, I would think that it's one aspect that we gained from Sweden, because that's something that is done in Sweden, and we've now introduced. We have already trained 3 nurses in labor coordination, and we also are mentoring another 3 in the same labor coordination. The other thing that I wanted to say, and that I think is a benefit for us from the collaboration, has been reviews. These are maternal mortality reviews and neonatal near-miss and mortality reviews. For every time that we have a chance and we have lost a mother, unfortunately, we've ensured that we do review them within 24 hours with what we call criterion-based review, to ensure that we get the areas that we think we made mistakes and how to correct them so that we prevent this in future. We also do that for babies who have had a near-miss mortality or who have had complications. So we again review them within 24 hours to ensure that if the areas that we can improve on, we improve on and prevent maternal mortality. We do the same also for babies who end up in NBU for reasons that we think might have been a human error. Because there are babies who are born, but born through a process of labor where the labor was not monitored well. So if there are any complications, we do follow them up and ensure that we review them and discuss them in our monthly mortality reviews. This is something that I think Swedish team have really contributed a lot, and we are very grateful to them. We have also had the experience of, in the collaboration, we have had the experience of and the opportunity to learn new aspects, such as how to treat our fellow students, our students, because students, previously I think we used to treat them as low-class people, but now with the respect that we've been, the values that we've been inducted into, we see students as future colleagues, and therefore we treat them differently. We would want everybody to learn that a student who is probably training in your field is actually a future colleague. We treat them with humanity and also with respect, so that they don't feel like they're out of place. In that aspect, we've actually ensured that the learning environment for the students has greatly improved. And even our colleagues, the way we treat ourselves, among ourselves, has greatly improved because of the values that we've actually gotten inducted into.
Even just by cooperating in the University of Linkoping, by our staff going there, by their staff coming here, we are able also to have a bit of cultural exchange. And the way we view things also, is changed in the process. And therefore, I want to say that as Moi Teaching and Referral Hospital, and by extension Moi University, we are a better lot by cooperating with the University of Linköping and the county government of the region of Östergötland in Sweden.
Linköping University currently implements the students' word as the pioneers in the world, which is very successful as it brings teamwork and professional respect during training.
Overall, the collaboration has then benefited Moi University in terms of staff capacity. That a number of lecturers in the School of Medicine, School of Nursing have been beneficiaries of the CEDA collaboration through capacity building by training up to master's, PhD levels and other specializations.
One of the initial PhD colleagues that went to Linköping or did PhD in collaboration with Linköping was, of course, our own Professor Fabian Esamai, and there have been a number of colleagues who have benefited from this collaboration.
The successful implementation of problem-based learning in the medical training in Linköping over the years has had a great impact on training programs in all other medical schools in Sweden.
The key point that we want to look at going forward is how to build on this 30-year relationship, consolidate it, and grow beyond it, and become greater than what we have done so far. So in this regard, we are looking at areas that we have not been collaborating as much, and this includes in developing new innovative programs, for instance, in biomedical engineering, where we will be working together with the School of Engineering and the School of Medicine and other schools to design a program that responds to the engineering needs in the health environment. Other areas we have discussed is in the area of aviation medicine, where we intend to start training our doctors to be able to become aviation medical examiners, which is a field that is lacking in this region, and people have to go elsewhere for this kind of training. We also intend to strengthen our relationship in the laboratory departments, where Linkoping has an edge with more laboratory research, more laboratory-based programs, and with our launch of our new medical laboratory science bachelor's training program, we expect to have some twinning with a similar program in Linkoping. Beyond that, we intend to grow and continue growing our clinical collaboration, exchanging local knowledge. So we are looking forward to this relationship growing further. We are looking forward to another 30 years of collaboration. We are looking forward to the next generation of leaders in health coming back here in 30 years' time and witnessing the kind of growth that we will have enabled starting today.
Overall, we would want to say that we are really, grateful for the opportunity given to us by Linkoping, and we would like to have, a collaboration that will leave a legacy in this world for a long time to come. And those of us who are coming in to, run the institutions, the two institutions, would like to encourage you to continue to make sure that this collaboration doesn't stop anytime, any soon.